case you were wondering what causes your recent stomach ache, the NICD Center for Enteric Diseases says it's had to deal with tummy ache cases caused by contaminated cake mix, dirty municipal water, and even sanitizer in homemade beer. In its annual report for the 2020-2021 financial year, the agency conducted surveillance studies on bacteria, viruses, and pathogens that can result in disease outbreak. Let's break this all down for you. Bring in Dr. Linda Erasmus, who's the divisional head of the NICD's Public Health Surveillance and Response Unit. The good doctor joins us via our video link for more on this report. And Dr. Erasmus, it's great to have you in the program. Thanks very much indeed for making time. Can we perhaps start by you helping us understand a bit better what the Center for Enteric Diseases actually does?
Thank you for having me, yes. So we are part of the National Institute for Communicable Diseases, and what we do is watch and try and keep updated with all the gut-related diseases that are happening in the country and infections. So we look out for foodborne diseases, which are notifiable medical conditions, so people need to tell the NICD about it, and that in turn gets given to the Department of Health. In addition, we also do laboratory surveillance, so we look particularly at diseases that have potential to cause epidemics. And epidemics are the potential to cause a lot of cases in a given area in a short space of time. So, for example, cholera or typhoid would be examples of those. So we look at all the cases that are coming through to the private and the public laboratories throughout the country. We look at how they are genetically so that we can see if any of them are related. We look at how they respond to antibiotics, and that's a lot of what we do. And then obviously we keep up to date with development of what's happening throughout the world and just generally.
Yeah. So enteric, as far as I understand it, means, occurring in the intestine. So you're essentially studying whatever kind of diseases or pathogens may be in the intestine. And I guess the obvious question then becomes, how do you do that? I don't imagine you have people walking into your labs and you scanning the intestines or something like that. So what's the procedure?
Okay, so as I mentioned, let me take foodborne diseases as an example.
Right.
Is a notifiable medical condition. So if a GP or any healthcare worker has a situation where two people have a similar gastro disease and they are linked in some way, for example, they attended the same funeral, went to a restaurant, ate at a school or whatever, then they report that, and the district will then investigate, and we will offer technical support in terms of laboratory testing as well as, just epidemiological testing. And what that'll often involve is just talking to the patients, seeing what they ate, and then many different diseases can cause the foodborne outbreak.
Right.
So it may be a microorganism, it may be a virus, it may be a bacteria, a parasite. Sometimes even chemicals can cause the foodborne disease. And sometimes just by knowing the time period from when they ate to when they got sick can give us a clue. And then also how they got sick. So some diseases, you generally get diarrhea, vomiting, maybe fever, abdominal pain. And certain diseases may be associated more with vomiting, others more with diarrhea, and those can give us clues. And then what we do like to try and get is samples from the patients, and that's usually a stool or a poop sample that we can then test in the lab to try and find the organism. And then if it's an outbreak that's linked to a specific food, if there's any food left over, then we could also, the district use environmental health practitioners to sample that food and also see if they can grow the same bugs. But I think what's also important is that these are opportunities to just educate people as well in terms of food safety and the various things we can do to try and keep our food safe when we're cooking and preparing food in the home as well.
Absolutely. So now that we understand how you work, let's speak about what you found, at least in the last financial year. So dirty municipal water causing some of the illnesses you've seen, contaminated cake mix, and this one I think is probably most interesting to people, sanitizer in homemade beer. What does that tell you?
We are sometimes amazed at what can go into homemade beer. And I think it's really just demonstrating exactly what we said, that foodborne disease is such a big topic, you know, that there are so many causes of this. And one of them is chemicals and things that may have been added to a home brew or something else. And then also the number of organisms that you know, can happen. And sometimes outbreaks may occur more in a crowded, close conditions. For example, a cruise ship where you sometimes get reports of a norovirus, which can also happen in a hospital setting or can happen in a childcare center, you know, where it's very contagious, and those crowded, close conditions lend themselves to those kind of outbreaks.
Sure. Sanitizer in homemade beer is certainly a new thing for me, but I imagine you've heard, call it, more bizarre things you've found. Are you able to take us through perhaps some of the things that still have you scratching your head when you've discovered what they are and how on earth they landed up in anyone's food?
There are numerous things that people put into food, and I think also what can be a problem is when people go foraging in fields, some of the things that people may find and eat thinking that they're safe. You know, we all know the stories about poisonous mushrooms.
Right.
That, you know, and maybe the other point that I'd like to make is, you know, obviously sometimes you take food out the fridge and you think, oh, maybe this is a bit off. But very often food that is contaminated, so food that has germs in it that can potentially cause disease, can look absolutely normal. And that's why it's so important to just follow safe preparation practices all the time, because the food may not necessarily look like there's anything wrong with it.
I'm interested to find out how much of the work you do actually might be helpful in trying to even detect illnesses before they become pandemics. And obviously we're speaking about this in the context of COVID-19, but have there been instances where you've been able to detect something preemptively and intervene perhaps by raising the alarm and prevented what I imagine could have turned out to be either an endemic or a pandemic?
So that's the reason that those foodborne diseases are notifiable medical diseases. So they've got to be notified really quickly. If they're category 1, it's within, you know, a day of having found those patients. And that is exactly so that we can try and intervene quickly. So, for example, not all cholera can cause epidemics, but any cholera case that we get would immediately be alerted, and we would follow up with the laboratories and then look at that cholera and look at whether it was the type of cholera that has potential to spread very quickly. And if it did, we would obviously need to then take public health action. If it doesn't, it may be one of the ones that just causes, you know, a one-off case. But for example, if you know that there's a problem in an area, one of the things you can do is just alert people that either they must use, so the municipality may provide an alternate water source, for example, or you can alert people that for the moment they should be boiling water, which can clean the water, or maybe adding bleach, which is chlorine, to clean that water. So very definitely the reason you want to identify many of these things quickly is to prevent them from spreading before, you know, to catch them and put in interventions before they spread.
Sure, fascinating discussion. Thank you so much for making time. Really do appreciate your insights this morning. Dr. Linda Erasmus is the divisional head of the NICD's Public Health Surveillance and Response Unit. Once again,